Okay, in this screencast, we're going to begin talking about CPR for the adult and the child. It's the same for both. The only thing that really changes is maybe the depth of the compressions on a child versus an adult. But based on the requirements that you need to know, we're going to talk more so about the adult, but we're going to talk a little bit about the child when we watch the video on how to actually perform CPR. In the previous screencast, we talked about cardiac emergencies, how to recognize a heart attack. We talked about the cardiac chain of survival. So it's really important that we're trying to do right now is we're trying to set the stage for a point where right now you have recognized that you have a victim who's in cardiac arrest for whatever the reason is, and CPR is now required. Remember, the reason why we perform CPR is we are attempting to act as if we're the heart to adequately pump oxygenated blood throughout the body, and then we are breathing in an attempt to add more oxygen into the body to try to keep that body as long as possible. If you have somebody who is in cardiac arrest, CPR alone, more often than not, will not be enough to save the person. Many times we're going to also need the AED. So in this video, we're going to talk about how to perform CPR, and then in the upcoming screencast, we'll talk about how to properly use an AED, which once again stands for an automated external defibrillator. With CPR, it is a combination of chest compressions and rescue breaths. We are going to talk about both, and then inevitably we are going to perform these in class as well. So it's a combination of chest compressions and rescue breaths. Artificially takes over the functions of the lungs and the heart, and what we're attempting to do is increase the chance of survival for a person who's in cardiac arrest. And they can be in cardiac arrest once again for a number of reasons. The most common cause why somebody would be in cardiac arrest once again would be that of a heart attack. What we want to do is we want to use the check call care. So it says check, what we want to do is we want to check, is the scene safe? If the scene is unsafe, if there's any dangers, whatever, then we might want to stay out of that scene because we ourselves don't want to become a victim. But we want to check how many victims are there, is the scene safe, is there actually an emergency going on, etc. We then want to call. Call means we're going to call 911 or the local emergency number because we want to get advanced medical care there as quickly as possible. And then care. And what care once again means is we want to provide whatever level of care that we feel comfortable providing. And the care that you would be comfortable hopefully providing would be that of performing CPR and possibly using an AED as well. We have a victim who's unconscious. If they're unconscious, there's a very likelihood that they're not breathing as well. So we're once again checking the scene. If they're unconscious, we're calling. When we check for breathing, we check for breathing for no more than 10 seconds. Okay, so we're look, listen. If we have an open airway, we're going to look, listen, and feel for breathing. You want to get your ears close to the victim's mouth as possible. You want to make sure that your eyes are scanning the length of the body so you can see whether or not the chest is rising and falling. And you also want to feel, is there any breathing? Can you feel warmth on the side of your cheek? You're going to quickly do a body scan for severe bleeding. If the victim is not breathing, we're going to go right into CPR. Make sure the person is on a firm, flat surface. That's why you would not transport somebody who is having a heart attack yourself in a car. You would wait for EMS to arrive because if you did have to perform CPR, you do need that firm, flat surface.
Knowing how to correctly perform CPR will help you provide care to a person having a cardiac emergency until another trained responder or EMS personnel take over. First, you will learn how to give effective CPR compressions. Then we'll add giving rescue breaths. Finally, we will practice some cycles of CPR. This video is designed so you can practice the skill while you watch it. However, your instructor may ask you to practice the skill after watching the video. If so, watch closely. You'll practice soon. Now get ready to practice CPR. Position yourself next to the mannequin with your gloves on and your CPR breathing barrier ready. First, place the heel of one hand in the center of the chest along the breastbone. Then, place the other hand on top and lace your fingers together. Position your shoulders directly over your hands. Keep your arms as straight as possible and your fingers up and off the chest. Push hard and fast in the middle of the chest, at least 2 inches deep. Now, give 30 chest compressions. Try to keep an even pace. The compression should be at a rate of at least 100 per minute. Counting out loud can help you. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11.
Each compression should be smooth. Let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Okay? Stop. Give another full set of 30 compressions. Remember, keep an even pace. The recommended rate is at least 100 compressions per minute. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
Okay. Stop. CPR is performed in cycles of 30 chest compressions and 2 rescue breaths. To give rescue breaths, use a CPR breathing barrier if available. Tilt the head back and lift the chin up. Then pinch the nose shut and make a complete seal over the mouth. Blow in for about 1 second. Watch for the chest to rise and fall with each breath. If the chest does not rise, re-tilt the head and try another rescue breath. Your instructor will pause the video and help you practice giving rescue breaths. Now, practice doing cycles of 30 chest compressions, followed by 2 rescue breaths. Get into position. Place your hands on the center of the chest, fingers laced and up. Ready? Go.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13, 14, 15, 21, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13.
Okay, stop. Your instructor will pause the video to give you some feedback. When we begin again, we'll put together all the pieces you've learned to simulate a real response. Now let's simulate a real response, from checking the scene to checking an unconscious person and through a few cycles of CPR. Stand a few steps away from your mannequin. Your gloves should be on, and you should have a CPR breathing barrier ready to go. On my cue, check the scene for safety, then check the unconscious person. You will be given only the information necessary to make a decision about what to do next. Ready? Go. The scene is safe.
Are you okay? Are you okay?
There is no response.
Call 911. This person's unconscious. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000.
There is no breathing.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and
Do not stop CPR except in one of these situations. You notice an obvious sign of life. An automated external defibrillator, or AED, is ready to use. Another trained responder or EMS personnel take over. You are too exhausted to continue. Or the scene becomes unsafe. There are two distinct differences between performing CPR on an adult and performing CPR on a child. After checking for breathing, give 2 rescue breaths. Then, quickly scan for severe bleeding and start chest compressions. Adults do not receive these 2 initial rescue breaths. Second, when performing chest compressions on a child, push down about 2 inches. For adults, push down at least 2 inches. Hand position and speed when performing compressions are the same for adults and children, as well as the CPR cycle of 30 chest compressions, followed by 2 rescue breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Once again, just a quick review. The only time we perform CPR is we have a victim that is unconscious and that victim also is not breathing. A couple differences that were talked about in the video. When you have an adult, you look, listen, and feel for breathing after you've checked to see whether or not the scene is safe. If your adult victim is not breathing, you immediately go into chest compressions performing CPR. Remember, at a depth of at least 2 inches deep, 30 chest compressions followed by 2 breaths. With a child, there's a little bit of a difference like they talked about in the video. With the child, once you've checked scene safety, once you've determined that the child is not breathing, you first give 2 breaths, then you go into chest compressions, and you go about 2 inches, which means your chest compressions on an adult will be a little bit deeper than that of a child. Once again, CPR can save a life. The earlier we start CPR, the better off that victim is going to be, but we only perform CPR if we have a victim that is unconscious and is not breathing. But also, like I mentioned earlier, typically CPR alone is not enough to save a life when you have somebody who's in full-blown cardiac arrest. We are also going to need that automated external defibrillator, the AED. So the upcoming screencast we will talk about how to use an AED and watch some videos on the proper usage as well.